My name is Brenda, and I will be talking about muscular dystrophy. Muscular dystrophy is a progressive disease that causes weakness and loss of muscle mass. What causes muscular dystrophy is a mutation in the genes that interferes with production of proteins needed to form healthy muscle. So while some forms of muscular dystrophy are seen in early childhood, others may not appear until middle age or later. So the main signs and symptoms of muscular dystrophy is progressive muscle weakness. But the more specific signs depend on the type of muscular dystrophy an individual has. So the first type is Duchenne muscular dystrophy. So an individual typically has muscle pain, stiffness, they walk on their toes, they have a large calf muscles, they experience frequent falls, they have a difficulty getting up from a lying or sitting position, they have learning disabilities, and a wadding gait. Second type is Becker muscular dystrophy. Signs and symptoms are similar to Duchenne, but are more mild and progress slowly. The third type is myotonic muscular dystrophy, also known as Steiner's disease. So the individual has prolonged muscle spasms, and the muscles of the face and the neck are affected first. So these individuals have long, thin faces, drooping eyelids, and a swan-like neck. The fourth type is facioscapulohumeral muscular dystrophy. So muscle weakness typically begins in the face and the shoulders. So the individual's shoulder blades may stick out when they raise their arms. An onset is in their teens, but it may begin in childhood or as late as age 40. The fifth type is congenital muscular dystrophy, which typically appears at birth or before the age of 2. So the infant has hypotonia or lack of muscle tone, so later they may be slow to meet milestones such as rolling over, sitting up, or walking. So some forms of congenital muscular dystrophy progress slowly with mild disabilities, while others progress more rapidly with severe impairment. The last type is limb girdle muscular dystrophy. So the muscles of the hips and shoulders are affected first. So with this, they have difficulty lifting the front part of the foot, and they experience frequent falls. So an onset begins in childhood or in their teens. Causes and risk factors. So there are certain genes that are involved in making proteins that protect muscle fibers from damage. So typically, muscular dystrophy occurs when one of these genes is defective. And the protein associated with this gene was dystrophin. So basically, there's a genetic mutation that occurs in the genes that causes muscular dystrophy. So many of the mutations are inherited, while others occur spontaneously in the mother's egg or developing embryo. So risk factors is mainly family history. So people with a family history are at a higher risk of developing the disease or passing it on to their children. And typically, muscular dystrophy occurs in both sexes, so boys and girls of all ages and races. Some of the complications is the inability to walk, so many will need a wheelchair to help them get around, shortening of muscle or tendons around their joints, they have breathing problems, they have a curved spine, some have heart problems and swallowing problems. Test and diagnosis. So typically it starts with getting a detailed medical history and a physical exam. Afterward, the doctor may recommend the following: an enzyme test, electromyography or an EMG, genetic testing, muscle biopsy, heart monitoring tests, and lung monitoring tests. Treatment and medication. Some medication that is given to individuals are corticosteroids, which help improve muscle strength and help delay muscle deterioration. Immunosuppressive drugs help delay some damage to dying muscle cells. Anticonvulsants help treat muscle spasms. Antibiotics, which help treat respiratory infections. Individuals also get physical therapy, which can help improve movement and help keep muscles as flexible and strong as possible. Occupational therapy helps with a loss of mobility, so some need to learn new ways to perform a task. Speech therapy helps individuals whose facial and throat muscles have weakened. Respiratory therapy helps treat those that have respiratory muscle weakness. Lastly, corrective surgery helps treat conditions that result from muscular dystrophy. Some conditions are cataract surgery, tendon or muscle release surgery, and spinal surgery. Prognosis. Prognosis varies on the type of muscular dystrophy an individual has and the speed of the progression. While some types are mild and progress slowly, allowing the individual to have a normal life expectancy, other types are more severe and cause a functional disability. So overall life expectancy depends on the degree of muscle weakness as well as respiratory and/or cardiac complications. So while there is no cure for muscular dystrophy, doctors can help manage it and slow down the progression of the disease.